All right, good morning, everybody, and thanks for having me today. My talk actually builds on a lot of what was said in this this last panel, but also I think we'll hopefully show some examples of how AI is actually in today's healthcare system working and providing a lot of benefit here. So let me see here. Okay, my notes are over here. Okay. So, first of all, I'll just build this slide out. Obviously, this was just discussed in the last panel, how AI, the chat, what they call it, a consumer event, the chat GPT really brought AI to the forefront. But in reality, like was said, we've been working on this for a long time in the life sciences space. And I'm not going to go through all of this. Some of these examples were already cited. There's some really exciting examples of AI being used in like tracking your wellness statistics. And matter of fact, the monitor that I wear just this week incorporated a generative AI component to it. And I tested it out yesterday, and how can I improve my sleep? And it told me, go to bed earlier and don't drink so much. But so I'm not sure I needed generative AI for that. But there was other tips in there too. But those were the top two. And then the deep, and there's some scary things like the deep fake. I was just at one of the, I won't name the name, but one of the, if not the largest AI company in the world a few weeks ago, and they showed me just how easy they can generate these deep fakes. Or they can be generated, and just how realistic they are. It was quite amazing and quite scary. So there, I'll come back to this at the end. There's definitely, some risks here that I'll talk to at the end here. But let me talk about some of the exciting things. So, and I know many of you in the audience here are either directly involved or tangentially involved in the medical technology space. It's very exciting right now. You've got we're at the epicenter here of technology in the human body. And with the advancements in technology, whether that be, traditional biomedical engineering where electronics are getting smaller, batteries are getting smaller, lasting longer, sensors are getting smaller and cheaper and are everywhere. And then you bring in, some of this digital technology, everything's connected, whether it be Bluetooth, Wi-Fi, 5G, computing power on the edge, in the cloud, quantum, now these language models, this machine learning and AI and robotics. I mean, there's just a whole lot going on. And, it's helping us learn so much about the human body. We know an awful lot about the heart, and it's amazing what we're doing today with medical devices to alleviate, or alleviate pain, restore health, extend life for people with cardiovascular disease. And we're learning, we talk about the brain, we're learning so much about the brain. We're putting commercially available sensors now inside the brain that can sense inside the brain. This is new, and since we've done that in the last year, we're just the amount of data we're getting and what we're learning is just unbelievable. So a lot of exciting. But getting back to the AI piece here, there's three themes in my very quick talk here. One is examples of how it's really helping products today just become better. The other, how it's driving new partnerships. I mentioned, not just medical technology companies with hospitals and physicians, and of course the FDA, but also with big tech companies. And then how we're moving, to these ecosystems. That's a word you heard. We're moving beyond discrete products to integrated products where the patient is at the center of a care pathway that's really made better by AI. Here's some of the examples I'm going to highlight. It wasn't too long. It's kind of unusual to put up a chart about leading medical devices where they both look like little computers versus like a pacemaker or a diabetes pump or a surgical tool. These are what medical devices are looking like more and more. The first one, I'm going to give you an example in the GI space, gastrointestinal space. The second one in the middle there is something we're using to train physicians around the world and ensure safety. And the third is an example of a surgical ecosystem I'm going to walk you through here. The first one is, we've got a number of AI-approved, FDA-approved AI products out there. And the first one, I'm going to give you an example. It's an easy one to understand. This is in the colon cancer space. And the challenge here is that you've got gastroenterologists, GI docs, doing colonoscopies. They do 8 to 10 a day. They have to make real-time decisions based on what they see. And the metadata that we use to get this product approved shows that 26% of polyps are missed. And there's a high correlation between polyps and cancer. And oh, by the way, it gets worse as the day goes on. There's a 12.5% fall off between the morning and the afternoon. So 1, get your colonoscopy, 2, get it in the morning, but 3, get it with AI. Okay, so here's what we've done here. We put that little box is an NVIDIA product that we've worked with NVIDIA on. It's in the GI suite. It's providing the compute in the AI suite to basically integrate AI into your traditional colonoscopy. That company Cosmo we partnered with on building the algorithm, because just to go back to the last talk, generative AI, it's not ready for prime time, not even close for what we do in treating patients. The generative AI is about 72% accurate. We need to be a lot more accurate, and we have to build our own models. And so what we had, that's why we had a partner on this one. This model was built with 13 million video images, okay, from multiple centers around the world. And it was a very diverse set of patients and in partnership with the FDA. So let me just show you the video. That's what a normal colonoscopy looks like. To me, it looks like a lot of pink, and it's hard to tell what's what. Now you add the AI to it. Let me see here. It should. Whoop, did not. Let me go back. Let me go back here. It's not working there. Okay. That's what it looks like. Now, I hit again. It's supposed to have the AI there. One more time. That's not working. Oh, there you see it. See, those green boxes are popping up. Those green boxes are polyps. And they pop up when and if you can look, as you see, it's hard to tell, okay? And so that's why so many of these things are missed. This algorithm is, from a sensitivity perspective, is 99.7% sensitive, which means we virtually miss nothing. And when we tell you that it's a polyp, less than 1% of the time there's a false positive, so you can trust it. And this was validated with real-world data, but you can see the manual nature of looking through 13 million videos and labeling that data. It's very manually intensive to label that data, using experts to say this is a polyp, this isn't a polyp. So it gives you just a sense for what goes into this. But amazing progress here. This is becoming a standard of care quickly around the United States, and it will go around the world. Another example is the training example. Today, videos are used to train physicians, but it's kind of inefficient. Think about like in sports where you have a coach or a commentator on TV breaking down an instant replay of a sporting event. That's kind of what has to happen in surgery, but there's so many different types of surgery, so many variations, that's very inefficient. So we're now using AI to do that, we've built a platform here that's integrated surgical instruments, imaging data, very seamlessly, and then we use AI to break down that procedure and train physicians. So what you see here is, for example, that's a soft tissue surgery, like a colorectal surgery there, and you're seeing the different organs lit up. So you're training surgeons on here's what different structures of the body, go here, don't go there, and you can see each step of the surgery and how they're breaking it down. And again, so this is another example of how we're doing this. So you walk out of a surgery, and this is instantly on a physician's phone. The last thing I want to say, building on that last example, you hear a lot about robotic surgery, and we just launched, Medtronic just launched a Hugo, it's called, a soft tissue robot there, and you can see it's outside the United States right now in clinical trials in the U.S., and you still see it's surgeons really driving that. So it's limited, so the precision's improved, but you're still relying on the surgeon's expertise. So you're precise, but if you have a bad plan, you're precise to a bad plan. Going back to that last example, using all those videos are not just being used for training surgeons. We're using that to build, basically, think about self-driving technology in the OR, so you're not wholly reliant on the surgeon. we're using the AI built on all these millions of surgeries to guide this robot, plan the surgery, guide the surgeon through the procedure. And I would agree with the last panel. We're nowhere near replacing surgeons, but I'll tell you this, surgeons that use AI will be replacing very quickly surgeons that don't. And so this is a surgeon assist technology. And then, again, last thing here, running out of time, is think about you walk into an OR and you see all this different disparate equipment. That's all now being integrated, connected by software. We're integrating the hardware as well, but connected by software and AI. So think about AI pulling together the care pathway of a patient, putting the patient at the middle. So you have an AI-based surgical plan. That surgical plan is just fed into this connected set of hardware in the OR that, like the robot I just showed you, that actually performs the surgery. And then there's follow-up here, and we're tracking the patients using imaging and other sensors after they leave the surgery, and there's a closed loop there, constantly making that algorithm better and better. So lots going on, and as was mentioned both by Chelsea in the previous panel, there's a lot of concern about the ethics of this. At Medtronic, we've come up with what we call an AI compass, but this is something that we've got to collaborate with others in the medical technology industry, the provider side, the payers, of course the regulators. The FDA is very involved in this, and just governments in general. There's going to have to be a compass, if you will, guiding how we use this data, making sure we're protecting it properly, and the privacy, preventing bias. There's a number of elements to this. So this is something we're using. But where there's no pride in authorship here, we're going to be we're collaborating with all types of organizations across the ecosystem to make sure this is done right, because it is so powerful. So, the last panel talked about, I agree that generative AI is not going to have a huge impact on, hardcore healthcare in the next 3 years. But the AI itself, machine learning AI, when you use the data we have available and you invest in making those models, these our own models, it's very powerful what we're seeing here, and I think we're just at the beginning. So I think you can basically, imagine a world here where we can deliver personalized care at scale, and that's extraordinary today. It's going to be ordinary tomorrow, and it's very exciting. And really, the technology that enables it, but more importantly, the partnerships that enable this are going to make it happen. So thank you very much for having me today. I think we're up for a break next, but I'll turn it back over to you.